Welcome back. We're glad that you're here today. My name is Steve Day. I'm the care pastor over at Calvary Community Church, and Pastor Curtis and Carol Lowe, who have put this on together with this church. Let's welcome them. They would never do that for themselves, and he's probably cringing right now, believe me, that I even said that. But they have such a heart, not only for their church, but for this community. And so he asked me just to take a couple of minutes and say why we at Calvary think this conference, this seminar is so important. And I would say not everybody at Calvary does, or we'd have them all here, you know. But in care ministry at Calvary and through our staff, we try to encourage as many of the staff and the volunteers to come to this. And here's why. Here's just a small story. I remember when my mother was dying of pancreatic cancer. My dad, you know, career military, he was right by her side through the whole thing. And friends from their church were over all the time, and they just walked him through it, prayed over him, were there for him. And when my mom passed away, I remember my dad about a month later saying to me, "Where'd everybody go? You know, my heart's broken. Nobody comes over. When I call them, they don't come over." And I said, "Dad, I think it's because people just don't know what to say. Their heart's broken too. They don't know what to say. They don't know what to do." And it's been my experience, or our experience in our church, maybe it has in yours too, that when we see people that have some sort of mental illness on some level, some more in your face than others, we kind of don't know what to say. And many times we don't know what to do. And sometimes we see somebody acting differently that, than we act, or that what we call is normal. And what do? We turn around and go the other way. Yeah, we do. We avoid them. There's this stigma that we talked about, you know. And I don't think that's abnormal. I think we don't know what to do with that. So that's why we encourage people from our church, and I hope you do too, and even for next year when Pastor Curtis does this, encourage your people to come, because we want our people to come and be educated. I want to come and be educated. You know, what somebody goes through that's dealing with depression, or like a great workshop I just went through that James gave on walking through that process of trauma in your life. So we can understand what other people are feeling and thinking and where they live, because all of us need Jesus, we know that, and all of us need some sort of healing, and we all need each other. And so that's why we encourage our people to come, and that's why every year I can't wait to come. Dr. Brad talked about schema, this inward direction, you know, for our lives. And I guess ours would be over where I come from, to strive to live and love like Jesus. So that's why we come, to be educated so we can go love on people that have mental illness and help their families and love on them. So glad you're here. Let me reintroduce Dr. Brad, and let's give him a hand as he comes. Thank you.
Well, we're going to try some more technology. I got the microphone on now, and we got a clicker, which I think I just left on the front row there, Curtis. Thank you. Not very extended. So this second hour kind of follows from the first hour. You've got to keep in mind this idea of extension. You've got to keep in mind that what I want you to think about is that we enhance our normal human limitations by being extended into things around us, into people around us. And that as an antidote to a spirituality and a Christian life that can tend to be quite individualistic, inward, and private, this kind of concept of cognitive extension in the church suggests we really, in fact, do need one another. That we're really better together than we are separately. that we can even enhance our Christian lives and our spirituality by being connected to one another. And that's so powerful when it comes to being the body of Christ, where we're all at different levels of dependency at different times in our lives. Because not only do we get to help one another, but we get to learn and grow by being in relationship to one another. So, if we really believe that about the church, then what can it particularly tell us about the church and mental illness? So we've already talked about embodied and embedded, and I'm not going to go over all of that again with you. But I want to talk about a particular kind of way of thinking about a certain type of mental illness. So I guess I need to do this. Could be. Nope, it's just moving my, here, let's do that. Oh, now we had something happen. Okay. I want to talk about extending our cognitions around mental illness, that's backwards, with a particular group of individuals. Is that okay, or are we in trouble? The reason I want to talk about personality disorders is a couple reasons. One is something that recently some of my students at Fuller in the doctoral clinical psych program said to me. They said, Brad, you know, more and more there's acceptance within churches, although we need to do a lot more, right? About the very common mental illnesses such as anxiety and depression. We know these affect a lot of people. But there's not much talk about these kinds of disorders. Because for one thing, they happen it's much less prevalent, right, than anxiety, mood disorders and things like that. However, in the church, these can be particularly problematic and particularly challenging, and these people need as much love and care and help as anybody. And I still think they have a lot to teach us in many, many ways. So what I want to talk about this afternoon with you is these 4 particular disorders of personality. And we have to remember again that when we're talking about a disorder of personality, we're talking about a chronic, ongoing, persistent pattern of behavior. It's not like anxiety that might come and go, or it's not like depression, which might lift after a treatment of medicine and psychotherapy. These personality disorders, I believe, or I wouldn't be in this business, I believe personalities can change and grow, but by their very definition, it's much more enduring and lasting. And it's much more problematic for individuals in many different kinds of ways. Oh, I think I keep using the wrong button there. I'll get used to it here. So why personalities? Well, as I already said, there's this growing awareness of other kinds of disorders, but not much discussion, I don't think, about personality disorders. Now, where things like depression hurt individuals, one of the things we know about personality disorders is they hurt others around them as much as they're hurting themselves. And so it becomes particularly difficult, and even though we oftentimes don't know what to say to someone dealing with depression, oftentimes we don't want to even talk to someone dealing with a personality disorder. And you may not have the name for this, but you will recognize it when you see it. I want to say again, though, personality disorders are often treated with not very much respect. And people talk in really derogatory ways about these individuals. And that's why it's really important, again, that we watch our language. And I'm trying to watch my language today. These are individuals with personality disorders. They are people. And there's a humanness that resides in these individuals. And frequently, what's going on for them, how they get to this place is because they've experienced oftentimes immense trauma early in their lives. And so what they're trying to do in very maladaptive ways is they're trying to find their way through life. They're trying to figure out how to be safe. They're trying to figure out how to get their needs met. But they're very, very maladaptive ways because of what they've experienced. And so they come out to the rest of us as hurtful, painful, off-putting frequently, troubling. And because of that, many psychotherapists say, well, I don't want to work with anyone with a personality disorder. And many churches say, we don't want to have anyone like that in our church. And many pastors don't know what to do with people who are suffering in this way, and yet at the same time, they find our ways to our churches. Because of course they should. Because we say this is a place where y'all come. Sick or not, right? We are a hospital for sinners. And for people who are struggling, we are the others and the foreigners and the strangers. So y'all come, except when someone becomes really problematic. Maybe we can put them in a special ministry over here. So again, while personality disorders are a small percentage of the population, they are in fact in our congregations. And it's important that I think we get a chance to talk about them. And I haven't been at, I don't think, any conferences like this where anyone has talked about personality disorders. So I thought, what the heck, let's see how much trouble I can get into doing this. It's really important, though, again, as we talk about this, that we recognize the difference between dimensional and categorical diagnoses. A categorical diagnosis suggests that you either have something or you don't have it, okay? We're moving a lot more in psychotherapy language to talk about dimensional diagnoses, which suggests, again, that we are all somewhere on a continuum. So as we talk about these different personality disorders, the truth is some of you might go, oh my goodness, do I have that? And some of you will say, oh my goodness, my mother-in-law definitely has that. We're all somewhere on a continuum because these are aspects of personality. These are parts of personality that means that we all can have those within us. It's not like these aspects of personality in and of themselves are bad. It's when they get pushed out of balance, when they get out of control, when the person is not able, for various reasons, to kind of to self-soothe, to think more clearly about a situation, and so it's personality that gets pushed into very uncomfortable and unhealthy places. And again, why does it matter that we think about personality in this way? I think it helps us to have empathy. Because if there's someone at times who it's difficult to have empathy for, it's individuals who are dealing with personality disorders. Because again, remember, sometimes they hurt us as much as they are hurting themselves. And they can be very off-putting, and so we want to have nothing to do with them. But if we could recognize that this is an aspect of personality, and I might have some of this too, maybe that can just help us build empathy for one another, which I think is key to providing care. This is an old book that I want to highly recommend to all of you. I checked, and it's still in print. Wayne Oates is a quite famous gentleman in the realm of pastoral psychology years ago. And he wrote this fantastic little book called Behind the Masks, Personality Disorders in Religious Behavior. And so I've used some of Dr. Oates' information here in addition to things like the DSM and the PDR and other things to kind of try to capture for us not only some of the symptoms and difficulties of people in these categories with personality disorders, but also to help us think about what might this look like in our churches. How might we see this? What kind of challenges might occur, and how best might we be able to come alongside these individuals? All right? Okay? Everybody with me? All right. Let's start with narcissistic personality disorder. Oates calls this the mask of self-assurance. And I love this image again because the use of mask suggests that what we see is not all there is. There's something else going on with this individual, and that's another way to build empathy. To say what we see that might be off-putting or troubling or disturbing to us, that's what this person is showing us for a whole variety of reasons, but it may not be what's really going on inside of them. They're trying to get something. They're trying to find something. They're trying to protect their insides in some ways. And this is the way that they have figured out to do it. It's not conscious. It's just sort of a process they learned growing up. And it can become, though, very maladaptive and problematic for them. So the central tension behind the mask for someone with narcissistic personality disorder is a kind of tension between inflation of how they see themselves and a deflation of their self-esteem. We often think about narcissists as people who can't get their heads in the door, right? It's so big. And we're used to the idea of the grandiose narcissist. The grandiose narcissist who tells us how great they are or how fantastic they are or how what they can do that nobody else can do. And they get to be so braggadocious that we just go, it's too much and I'm not sure I believe you anymore, right? Politicians are great at this, by the way. Some pastors are malignant narcissists. There's a whole research area in this. None of the pastors here today, but there's a whole research area on malignant narcissists and pastors. But even if we see this grandiosity, this will help you 100%. Remember, this person feels the opposite inside. What they feel is deep levels of shame, humiliation, sometimes contempt, and often envy. So they see something you have, and they want it. That's envy, right? Or they see how you're doing well, and they feel contemptuous about it. But it's because underneath what they feel is shame and humiliation. So they develop a mask where they try to convince the world and themselves that they're fine. In fact, they're better than fine. They're doing really, really well, thank you, and you should in fact admire me. The belief about themselves is that I need to be perfect to feel okay. Now that's a tough one, right? Anybody perfect here today? We can't do it, right? But if that's the central core belief that you're carrying around and sort of, again, I'm not suggesting these individuals know they're thinking that. Some know it more than others, but if that's kind of what you believe, that becomes highly problematic because what you're going to see is all the times you're not. All the times over and over again that you're not. They also have a belief about others. And it goes something like this. Others enjoy the good things in life, so the more of those I have, the better I will feel. So narcissists are often very concerned about outward appearance and what they have and what you have that they don't have and how can I get what you have that I don't have and how much better is my stuff than your stuff. And do you envy my stuff? I'd kind of like you to envy my stuff because I might envy your stuff and I don't like feeling that way. Okay? So can you sort of begin to develop some empathy for these individuals? They're kind of walking around maybe with a lot of bravado, but underneath are all these like really painful feelings that they don't want anyone to know, by the way. Anyone to know. And one of the ways they try to protect themselves is they kind of go back and forth between an idealization of themselves. They sort of believe their own press. And then a devaluation. They don't believe it. And they're terrified that everyone else is going to figure it out as well. Now, narcissists don't come to therapy on their own very frequently, right? Because that's to admit that something's wrong. Narcissists come to therapy when someone forces them, frequently. Sometimes it's a spouse, sometimes it's the kids, sometimes it's a pastor, sometimes it's the judge. And they can be notoriously difficult to work with. Because they're so defended against feeling vulnerable and ashamed. And of course, psychotherapy and counseling kind of goes right into that. Let's go right into what's painful for you. And they're kind of like, no thanks, I gave it the office, I'm out. So this is difficult, but these individuals need our love and understanding like everybody else. Because they can cause not only, again, pain in their own lives and their own family, but they can create pain in the church. So let's think for a second about narcissistic personality in the church. What might an individual look like? What kinds of religious behaviors might we notice? And these aren't all of them. You can probably imagine some, and I'm going to give you a chance a little bit later to talk to your neighbor about some of this. But one of the things we sometimes see with people suffering from narcissistic disorder is they may act sort of like God is at my beck and call. God's my man. I have a special relationship. I have a hotline to God. They may brag about it, they may talk about it, or they may expect it, and of course it becomes devastating when it doesn't happen. Or it becomes devastating when someone else exposes them for that in some way. But it's a kind of entitlement. You hear this entitlement when they interact with their family, their friends, their people at work, and there's almost a kind of similar entitlement at times with God. Okay, God, when are you going to show up? Again, because these individuals are terrified of shame, they're terrified of being exposed, what we see is that there's sort of this claim of infallibility. You know, they don't let down their guard. They don't want to let you know that they're hurting or they don't know something. And so it's all mask all the time. Well, what can we do? Well, again, we need to try to see behind the mask. we need to try to display empathy for them, particularly recognizing that there's something behind the mask. And that's difficult to do, but what I think we look for are times when the mask has a little crack. And another time that narcissists will ask for help is when they hit rock bottom, a little bit like an addict. When maybe the spouse leaves, when maybe the kids say, I don't want to have anything to do with you anymore, or the pastor comes alongside and says, you're creating such havoc and dissension in our church, I don't know what to do with you anymore. That's a crack, and that's a moment. And then we can move in and talk about the pain and shame that they feel underneath that. Again, very difficult because they don't want to own that, but I think it's the only way for us to connect. Group treatment, I think, can be particularly helpful with people suffering from narcissistic personality disorder, because in group treatment, people tell the truth to one another. They tell one another about how they're experiencing one another. And that's one of the things that a narcissist eventually has to learn and hear. They don't do a very good job recognizing how you feel about them. And they're not very good at being empathic toward you. So if they're in a group treatment where every week people are saying, that hurts my feelings, that sounds sexist, that was a jerky thing to say, if you can keep them in the group, that's the key, they can learn and grow. Let's talk about borderline personality disorder. This one is sort of infamous in the psychotherapy world, and some therapists, again, will say, I will have nothing to do with these individuals, and I think that usually means because, again, they're terrified, they don't know what to do, they're frightened, and therapists get frightened. Psychologists and counselors get afraid. Oates calls this the mask of chaos. For these individuals, it always sort of seems like chaos is happening wherever they go. Chaos seems to follow them, and/or they seem to create it wherever they go. Their difficulties have a lot to do with affect regulation, emotional regulation. They are people who blow up or collapse in fits of tears, and a lot of times we can't quite figure out why it's such a big deal, or we can't figure out why they can't bounce back from it in some ways. The intensity of their emotion seems bigger than the crime, okay? When the punishment doesn't fit the crime, we know something might be going on there in terms of personality. Oftentimes, the intensity has to do with aggression. Now, people struggling with borderline personality disorder can often come across as rageful, very, very angry. And if you wrong them, Pastor, you're going to hear about it. And if you don't hear about it, you're going to hear that other people have been hearing about it. Very difficult, then, for them to soothe themselves. We know from research that people suffering from borderline personality disorder have a much higher than normal rate of experiencing serious trauma in their childhood. And sometimes they fall under what might be called disorganized attachment styles, or certainly insecure attachment styles. So again, friends, these people aren't trying to be a pain in your side. They're trying to get through life the best way they know. The problem is it's very problematic. It causes problems for them, and it causes problems for us. The problems for themselves, again, are things like self-cohesion. They don't feel like the same person everywhere they go. They feel often fragmented. They feel like they're falling apart. They feel that other people can sort of come inside of them and hurt them and wound them very, very easily. And they have a huge fear of abandonment. If they feel like you're leaving them, they can panic. And so, that's really interesting to think about in a church again setting, right? We love you, but you need to stop doing this, we might say. But that might be experienced as abandonment. And if the person feels abandoned, then they might respond the only way they know how, which is with a rage response. So they have a lot of intense affects, as I said, especially rage, but again, shame and fear related to abandonment. The belief about their self is, I don't know who I am. Who am I? How does this world work? I can't figure other people out, and they don't seem to be able to figure me out. People with borderline personality disorder often feel very, very alone in one sense, and almost like Martians on the earth, because it's like I just can't quite figure out how this world works and how people work. The belief about others is that others are defined by their impact on me. So I've had the privilege, I will say that for sure, of working with a number of patients struggling with this disorder. And it's very common for 1 week for me to be the best therapist the world has ever seen. And the next week to be the most lousy, good-for-nothing, useless therapist the world has ever seen. Because I somehow wounded them. I somehow hurt them. And the truth is, I may have, or they may have misinterpreted what I was trying to do. But the response then is, you have hurt me. I'm defining myself by your impact on me. And therefore, the shame and the abandonment comes up. And the only way I know how to deal with that is to respond with rage. Which, of course, pushes me away, but at the same time, they want me to be close. So borderline patients are always doing something like this. Come here, come here, come here, come here, get away, get away, get away. And it's very challenging, but they're so afraid of being abandoned. Now, not only do they do that, you're good or you're bad, to the people around them, but the thing that we have to recognize is they're doing it to themselves. So one day, they feel pretty good about themselves. And the next day, they can feel like a pile of fill in the blank. And that's how bad it is for them. Borderline patients often have a lot of parasuicidal behaviors. It means they look like they're going to commit suicide. They may not be really wanting to, but they also do commit suicide, and sometimes accidentally. People with borderline personality disorder are oftentimes self-mutilators, self-injurious behavior. They make a lot of bad choices. They can get into a lot of difficulties and trouble, and they need safe places to be cared for. I'm going to keep going here. So let's talk about them, think about them in the church a little bit. Normal events for them, what we might think is normal, can become catastrophes. And for us to tell them to calm down doesn't work. We need to empathize with them at the same time that we're trying to help them see it a little more realistically. Some developmentalists have talked about borderline personality disorder when it's kind of hitting someone in a powerful way. It feels a little bit like the terrible twos. It feels a little bit like a child does when they don't know how to manage their emotions, right? And they can kind of blow up. But the good parent doesn't say, I'll give you something to cry about. Anybody hear that when they were growing up? But they say, oh my gosh, yes, this feels terrible. This is so awful. What can we do to make it better? Right? Staying connected, not abandoning, is key for these individuals. But it's really important because these individuals can take an immense amounts of time in the church. They can take immense amount of time from the pastors or the lay leaders. They want to have special meetings. They're often upset about something. They want to complain about Sister Jane. Did you hear what Sister Jane said about me? And it can create turmoil within people. And because they have a tendency to split good and bad, sometimes they have a way of getting the whole community kind of splitting good and bad. And again, it's not because they're terrible people. Again, please hear me. I'm not trying to be derogatory about people with personality disorders at all, because they're persons, and we're persons, and all of us have a little borderline, and all of us have a little narcissism. But it can cause a lot of tension, a lot of conflict, a lot of dissension in the church. They wear others out. They do this love you, hate you thing. Their fear of abandonment is so high that it can make helping them very, very difficult. I don't know if you've known people that you've tried to help, and it's like, you're just making this hard for me to help you. How am I? I'm trying to help you, but suddenly I'm the enemy. And that can happen quite frequently. So what people like Oates and the researchers in this area say is that one of the things that can help, again, most powerfully with people suffering from this disorder is creating a safe place for them. And isn't that what the church ought to be? A safe place. Y'all come, warts and all. Come with your intense affect. Come with your rage. Come with you don't know how to deal with anything, and we're going to come alongside of you. But you see, friends, again, how it's so important then that we're the body of Christ. One person cannot help a person with personality disorder. We need a whole church. And we're going to come back to that here toward the end. Here's another one that I think we sometimes see in the church. It's a little more difficult to see, perhaps, although maybe you've known people struggling with this, the dependent personality disorder. Oates calls this the mask of dependence. The tension for these individuals is keeping and losing relationships. So just like their name is, they can come across very dependent. I need you, don't leave me. So again, there's overlaps between some of these personality disorders, right? Because again, it's personality, and we all have to grapple with this. We all have to deal with this. For the dependent personality disorder, this individual's central emotions are things like they feel pleasure when they're securely attached. Everything's good in the world. But they feel deep sadness and fear when alone. So they really want to grab hold of someone. They really want to be connected with someone. And this is the kind of person that sometimes you feel a little bit like, I love you, but can you give me 5 feet? Can you give me a little emotional space? No, I can't talk to you every day about this. I'm just exhausted. I'm trying to be there for you, but you want. And if I say no, you collapse. Your feelings are deeply hurt. You're deeply wounded by that. Where perhaps another friend would be, cool, fine, I get it. You're tired. You need some space. I'll call you tomorrow. Okay? That doesn't happen so easily with this person. Their belief about themselves is I'm inadequate. I'm needy. If people really knew me, they would not like me. So these individuals actually in our churches are often extremely helpful. They want to get involved. They want you to need them, and they need to be needed. And they don't want to seem like they're a drain on anybody. They might be really helpful. They might be massive volunteers in your church, volunteers in your churches. Right? Because they want to be there for you. They want to engage. They want to be part of something. They don't want to be alone. But there's still problems that can occur because of their need. The belief about others is others are powerful, and I, in fact, need their care. So as I'm helping you, I need to be needed. I'm helping you because I need you to care for me. It's a very complex relationship that gets woven together and can create real problems, as you may know. And their defenses, the way they kind of try to manage this, is sometimes they'll go into periods where they just avoid everybody. Well, this is too dangerous. I'm not going to have anything to do with this, and they disappear from church. You ever had someone like that who's real involved, and then suddenly their feelings get hurt and they just disappear? And you wonder where they are, and you call them up, if you're a good church, right? Because what's the number one thing people say? I left church and no one called me for 3 weeks, right? Have you been there? We ought to reach out to people who are missing, but these people may be missing in order to get you to call. And also because they're just afraid. I'm going to avoid. I'm going to go into my cave. I'm going to be myself. Sometimes they're somatizers. You know what I mean by that? They have lots of physical problems because that's a way to draw people close. Now, again, I'm not suggesting that they're consciously doing this. I'm suggesting this is a way they have learned through their childhood and young adulthood that has somehow brought parents or caregivers close to them. And that's what all these people are trying to do. How can I stay connected? How can I be cared for? How can I have relationships with other people? And because of my problematic childhood, I've learned, again, these sort of maladaptive ways. They worked when I was a kid, but they don't work anymore now that I'm an adult. And regression. Regression simply means that sometimes they can become quite childlike. And they might collapse. One minute they may be really self-sufficient and really helping you with the ministry, and then if any of these things get activated in them, they get afraid and they feel alone, they may collapse. I don't know how to do anything anymore. I just don't feel like I'm up for it. And then it kind of draws us into their sphere. So again, I've already started to suggest what this might look like, but here's some more ways to think about it. These individuals are generally likable and highly compliant, even submissive in some ways. Sometimes think about the teacher's pet, or think about the pastor's right-hand person. This might be, not always, right, a dependent personality disorder. They need to get others to get what they want. So I need you to get what I need. I need you to get what I want. I don't feel self-sufficient. I don't feel capable of doing this myself. I really need you to do it. Because they feel weak and fragile at their core. Remember, what we're seeing is a mask. Frequently, these are conflict avoiders. They do a lot of stuff. They'll help a lot. But when conflict shows up, they're out. And you might know some people like that. And then again, as I've already mentioned, there's kind of this sense of isolation and fear of being alone. So in some ways, just like with the borderline personality disordered individual, we have to meet them with empathy. We have to connect to what's underneath the mask. We have to provide a safe place for them. And we have to find ways to empower them so they can begin to feel more and more self-efficacious on their own. while staying connected to us, right? Because we're never on our own. I also wanted to talk about the compulsive personality disorder. Now, most of you know obsessive compulsive disorder, right? And so that can have rituals, and it can have obsessions, and sometimes people are afraid of germs, so they'll spend hours washing their hands, or they might have all sorts of different other kind of rituals they can do before they go to bed, or whatever it might be. Terrible, terrible disorder, right? So much anxiety, and these individuals are at high risk for suicide. That's a little different than the compulsive personality disorder. I'm going to tattle on my own theological tradition for a second. I'm an ordained elder in the Church of the Nazarene, which some of you might know is in the Wesleyan tradition. In the Wesleyan tradition, our great-grandfather of theology is John Wesley, John and Charles Wesley. Well, John was really the theologian, and Charles was the hymn writer. But the hymns contain this theology in beautiful, beautiful ways. And people of all denominations sing Wesley hymns, so that makes me particularly happy. But John Wesley came out of the Church of England, and he was trying to kind of create a restoration movement in the church. He didn't really want to leave the Church of England, but he was really concerned that the Church of England had become sort of pompous and rich, and that the poor and the outcast were not receiving what they should be receiving. They weren't welcome in the church. They weren't being taken care of in the church. So he started to do a lot of field preaching. And he would go out in the fields, he'd ride his horse out there, and he'd preach. And then when people would get saved, he'd set up these class meetings, which basically just meant a bunch of people who wanted to follow Jesus, who were not necessarily part of a church. But John was a very methodical person, to say the least. He probably was obsessive-compulsive personality disorder. He not only created these class meetings, but he decided he needed other meetings within the meetings. So you could be part of a band. The band was a smaller group, and that's for people who are wanting to push on towards sanctification. And if you were even more serious than that, you could be in a select society, and that's a really small group, and it's only men or women, and you're really on the way to sanctification. And then he developed rules that every time the class meeting would come together, they were to answer a series of questions. Every time. My favorite question is, what sin did you commit this week? Can you imagine going to a small group now and someone asking you that? Another one was, have you given to the poor this week? Now, there's a lot of amazing good stuff in Wesley. I love his theology. But he was so methodical that they started to be called the Methodists. And it wasn't a compliment. It was like a dig. You know, these folks are too Methodist. They're too much in method, and they were even at times sort of accused of being Pelagians, which is this whole idea that somehow you can earn your own salvation through good works, which Wesley didn't really believe, but it's pretty easy to understand how that happened. So the compulsive personality disorder is the mask of too many scruples. This person is not obsessed with like germs or dirt or things like that. They're obsessed about morality. They want things to be morally perfect. That's just as bad, right? Just as difficult as trying to get all the germs off your hands. Interestingly, their tension that they carry around inside of them is this sort of strange tension between submission to authority versus rebellion against authority. I want to do what you say, and I don't want to do what you say. So what I'll do is I'll figure out the most holy way to be, and I'll be it. And maybe I'll write rules about it. The emotions they struggle with are emotions like anger, guilt, anxiety, again, shame and fear. Boy, shame shows up a lot, doesn't it? Shows up a lot. The belief about themselves is most of my feelings are dangerous and must be controlled. So obsessive-compulsive persons with personality disorder are not frequently really emotional folks. You know, they're not gonna get together with you over coffee and really dish. You know, if you get together with them over coffee and you say, I'm really struggling with this, they're going to say, well, have you tried that? Have you tried this? Well, you know what Scripture says. Well, you know what the manual says. You know what church dogma says, right? Because that actually makes them anxious. And so they're not trying to be jerks. Again, remember this, they're not trying to be jerks. They're trying to manage a sense of self that struggles with these kinds of feelings. The beliefs about others are others in less control than I am, so I have to be in control of them. and resist their control, right? Because again, it's submission and it's surrender for them. So they might think, in some level, that you're one of those liberal, loosey-goosey Christians. Let me tell you how you ought to be. You can't really control yourself, can you? Maybe you should follow my example. Again, not because they're trying to be better than you. They're trying to manage feelings that get stirred up inside of them when they begin to feel out of control. So the defenses they use a lot are intellectualization. That means they're thinkers. They're really up here in their head. I do this because of that. So sometimes someone with obsessive personality disorder may make wildly inaccurate assumptions or links between something they do and how they rationalize it, but that's the defense of intellectualization. And the other one they use, not surprisingly, is moralizing, right? Well, I don't do that because. You shouldn't do that because. But this is someone who suffers from what's sometimes talked about in the literature now as scrupulosity. They're just obsessed with morals and values. And you can see the link between obsessive-compulsive and obsessive-compulsive personality disorder. I don't know if any of you have had in your own life or someone you've known who becomes religiously obsessive. I mean, it's really, really painful because they're always afraid, oftentimes, of going to hell. They're afraid that they have committed a sin. I was reading a study the other day about somebody afraid that they had committed the unforgivable sin. So they kept calling pastors in over and over again to try to tell them they hadn't committed the unforgivable sin, but no pastor could do it in such a way that calmed them. And it's just painful to watch. And I think we really need to think, friends, as a side note, the way in which we do Christian education with our young people. Do we put the fear of God into them, or do we put the grace of God into them? Do we scare the hell out of them? If I may be so bold. Or do we teach them about a God who loves them and will never stop loving them no matter what they ever do? That's the good news of the gospel. Yes, grow. Yes, change. Yes, become more Christ-like. But God has already made his mind up about you. He loves you. That's powerful. To me, that's the good news of the gospel. Again, more ways to think about this person in the church. Compulsively moral, moral is fueled by their anxiety. Sometimes these people come across as stingy. I'm going to keep mine what's mine, and I'm not going to give that away. I got to be careful. I got to be perfectionist about this. I have perfectionistic control. Sometimes people are work addicted. Oftentimes, they're really concerned about their status in the church. Sometimes these people make really good and really bad treasurers in your church. Right? You can imagine the kind of quality they might do, but you can imagine how quickly this might become their thing. Don't come into my thing. I don't think that's a good idea, Pastor. I'm just going to have to say no to that. That'd create some tension, right? When the treasurer of the board tells the pastor no. Sometimes these individuals get involved in tattling. They'll come to the pastor and say, "Did you hear about Sister so-and-so? I just don't think it's Christian, Pastor. Something has to be done." Again, not because they're trying to be terrible. This is how they make sense of their world. But again, it hurts others as well. And I mentioned scrupulosity already. We live in this tension theologically between God's grace and God's law. Yes, God expects things from us. Yes, Scripture is a book that tells us about the most moral way to live, the best way to live, we believe. But thank God it's covered with grace. Because God knows that we're never going to live up to it. We're never going to make it all the way there. All right, so let's extend our minds a little bit. Remember I said that we are smarter together than we are alone, that we actually can extend our normal human limitations by incorporating other people around us. So I'd like you to do that for a few minutes with 1 or 2, 3 people around you. I want you to answer a couple questions. 3, actually. Have you run into any individuals with any of these traits in your church? That would be the first one. Okay? Secondly, if so, what kind, if any, challenges have they created? And third, what, if anything, have you seen that has been helpful or unhelpful? And by the way, if you want to confess and say, yikes, I feel like I'm a little bit like this, that's okay too. No forced confession, but it's a great way to build empathy. All right? So I'm going to give you a little time, if that's okay, Curtis, to turn around, 2s, 3s, and answer these questions. We'll leave them up here, okay? So, there is a lot of wisdom in this room. I'd love to hear some of it. I'm just going to assume that at some point in our life or in our congregations, we've run across some people suffering from these types of problems. What have you seen that has been helpful? Anybody, just yell it out, stand up, tell us all. And remember, I'm a therapist, so I can sit and be quiet for a really long time. Yes? Okay, you have to remember, I'm the teacher and you're the students, which means I ask the questions and you give the answers. I don't know how that got confused. No, I do want to, I'll just answer that quickly. Constant object. We have to do our very best in the midst of what sometimes seems like a storm to be consistent, to be consistently loving, consistently caring, consistently setting boundaries. Boundaries are okay, and they're loving for us and they're loving for others, if we know how to do them well. But not to take the bait. Not to chase someone down or not to go, fine, well, you hate me, I'm out. I'm here when you want to talk. I know you're upset. I'd like to be helpful. I'm here. Yeah.
You had histrionic up as a category, but didn't explain what's that.
I did? Well, that was a mistake. Oh, yeah. You mean in my original, yeah. I decided not to go with that one. Yeah. It's a really histrionic question, by the way. It's all about you and your questions. No, someone suffering from histrionic disorder, sometimes it looks a little bit like borderline personality disorder initially. This is someone who, again, also seems to find a lot of drama, who is very often, again, all these disorders have to do with relational patterns. And for the person suffering from this disorder, I want to connect with you, but I'm not really sure how to do that. And so oftentimes what they've learned is that if there's a crisis, people will come to me. And so even more than a person with borderline personality disorder sometimes, they seem to have a lot of crises, but it's their way to try to bring people close to them because they're afraid. Yeah. Okay, come on, back on track, people. What has worked well in your churches? Anything? Yes, thank you. Yeah, I love that. Did you hear that? Help them know that they are fully forgiven by God. And our forgiveness from others, our love for others comes first from the love and forgiveness we've received from God in Christ Jesus, right? And that can be really hard to communicate, not just to people with personality disorders, but many of us struggle with that, right? What else has been helpful that you've seen? Yeah.
I think one of the things that I've noticed personally over the years is, and in larger institutions, we were talking about this is harder. So you have to have the capacity to take the time with these people. And a lot of times in fast-moving organizations, they don't want to take the time.
Right.
And so we kind of leave them behind or run them over.
Right. Yeah, this is a. I know last year, Dr. Wong talked about the ministry of presence. And these individuals can really, all of us, right, suffering from whatever, all of us on that dependency need continuum, what we need is a ministry of presence, time that changes people in profound ways. Anything else you've seen that's been helpful? Yeah.
Sometimes just being very concrete. If somebody's very dependent, they are quick to say yes because they want you to like them and they over yes.
Yes.
I'm learning that if I set deadlines and boundaries, that
Yeah.
The person is able to complete their yes and the task gets completed.
Right, right. That's a great example, too, because I think sometimes people struggling with that will say yes to about everything. They don't have a no. But then what happens is they can't get it all done. They start to look bad in the eyes of other people. They feel bad about themselves, and it's a vicious cycle. Yeah, thank you for that. Was there another hand right over here somewhere? Yes. Storytelling groups. Say more. Oh, yeah. Yeah, that's fantastic. People who do research in group psychotherapy, one of the things they say is one of the curative factors is what they call universalizing, which is the idea that we often come to therapy or we go through life thinking, I'm the only one struggling with this. And when I say it out loud and someone else goes, me too, suddenly something changes inside of us. So hearing stories. We used to have what we call testimony time in the church. Does anybody remember that? Maybe you still have that. Where people would get up and brag. No, people would get up. People would get up and talk about what God had done in their lives. And I think in some ways we've lost something in some of our churches, that we've lost that. However, we've moved in such a world of social media where it's all about presentation that I think testimonies today would be quite different than they were back in the day. Let me make a few more comments before we're out of time today. I want to suggest to us that in all of this we have to keep remembering that we're the body. And I want to read this passage to you. You know it, but it's one of my favorite passages, and it just bugs me. Like, you ever have a passage that just sticks with you and stays with you, and you keep thinking about it over and over and over again? This is a passage for me. 1 Corinthians 12, beginning at verse 12. Christ is just like the human body. The body is a unit, has many parts, and all the parts of the body are one body, even though they are many. We're all baptized by one Spirit into one body. Whether Jew or Greek, slave or free, whether typical or atypical. I added that one. We were all given one Spirit to drink. Certainly the body isn't one part, but many. If the foot says, I'm not part of the body because I'm not a hand, does that mean it's not part of the body? If the ear says, I'm not part of the body because I'm not an eye, does that mean it's not part of the body? If the whole body were an eye, what would happen to the hearing? And if the whole body were an ear, what would happen to the sense of smell? But as it is, God has placed each one of the parts in the body just like He wanted. If all were one in the same body part, what would happen to the body? But as it is, there are many parts, but one body. So the eye can't say to the hand, I don't need you. Or in turn, the head can't say to the feet, I don't need you. Instead, the parts of the body that people think are the weakest are the most necessary. The parts of the body that we think are less honorable are the ones we honor the most. The private parts of our body that aren't presentable are the ones that are given the most dignity. The parts of our body that are presentable don't need this. But God has put the body together, giving greater honor to the part with less honor, so that there won't be division in the body, and so the parts might have mutual concern for each other. If one part suffers, all the parts suffer with it. If one part gets the glory, all the parts celebrate it with it. You are the body of Christ and parts of each other. Whew. That's good stuff. I like to ask this question, is that a metaphor or something more? Yes, is my answer. It's a metaphor, but I think it's a metaphor that packs a punch. Like, in some level, it's real. At some level, it's true. And I think this is really important when it comes to the church and mental illness. No one person can do all the things that the body needs, especially when it comes to mental illness. And your comment about an organization where we don't have the time is a great example. Sometimes in church, when someone emerges who's struggling with something, we give them someone else an assignment to take care of them. Or it's the pastor's job to take care of them. I don't think that works very well, because what it leads is to burnout in those individuals who are trying to help. We really need a body approach. We need a team approach, because some people are really good at taking people out to coffee, right? And some of you are terrible at that. But you're really good at going over and helping someone change the oil in their car. You see what I'm saying? We need a team approach. We need a body approach when it comes to helping not just those suffering from mental illness, but all of us suffering. One quick example, in my church, we had a gentleman recently who, when not medicated, was pretty floridly psychotic. And he would, come down the aisle about the middle of the pastor's sermon and sort of look around, and he'd kind of sit down, and it was kind of a production, and he smelled of cigarettes and other sorts of things, and his name was John. And John could become violent, and John could become scary. But what the church tried to do, and I wish we were more successful than we actually ended up being, because John disappeared. But what we tried to do is find the people who John could hear and share that among us. So there were some guys that were really good when John was psychotic. And they were really good at coming alongside John, and lovingly but firming ways, right? Firmly ways, taking John places where he could chill. There was a young female pastor in our church who was like the John whisperer, though. And he would listen to anything she said. And she could talk him down for most things. But if we left that job just to her, she'd be burned out. He'd follow her around all day long. She had other things to do. So as we start to think about how we, again, as the church, as the body, as the extended body of Christ, I would really encourage you to think about this isn't one person's job. And it's not just the pastor's job. We have to be strategic and thoughtful about how many people are going to try to help this one particular person. Follow? I think that's so really helpful and important. And I love this passage too because of this line, right? The parts that we think are less honorable, we treat with special honor, so that we can care for one another. Again, friends, let's never forget, it's not just that we're the great saviors, because we're all in that continuum of need. But God gives us all the parts of the body to love and to learn from. And you need me, and I need you, and we need you, and you need us. Thanks so much.